Good afternoon. I'm Jan Mold, one of the assistant directors for Hosts of Future Health Professionals. I'm going to be talking about vital signs. When we say something is vital, that means that it is necessary for life. So we're going to be talking about 4 vital signs today. They include temperature, pulse, respiration, and blood pressure. One of the things that you are guaranteed in healthcare is that abbreviations are going to be used. And you may see these abbreviations in relation to vital signs. The first one is TPR, temperature, pulse, and respiration. The next is BP, blood pressure. WNL means within normal limits, and BPM means beats per minute. So if you do a clinical internship, you may see those in the record. As you're sitting here, your body is producing heat. If you began to exercise, it would be more heat. Heat is lost through the skin's, lungs, and waste products. You may have seen in the newborn nursery the babies with little stocking caps on, and the reason they wear stocking caps is so much of a percentage of their body is their head that it keeps them warmer than if they didn't have the cap on. But your body's continually making heat, but it's continually giving off heat to maintain a homeostatic environment. You probably haven't gotten this far without having a temperature. So if you think about the symptoms you had, pink, reddish skin, warm to touch, and I know all of you have had the mom's test where mom puts her hand, back of her hand on your forehead to see if you're running a temperature. Folks with a temperature may be restless. They also may be thirsty, again, as their body tries to decrease the amount of temperature. There are different ways to take a temperature, different kinds of thermometers. One is oral, which is placed under the tongue. Obviously, we're not going to use this for a young child or somebody who has dementia that couldn't hold the oral thermometer in place. Rectal, and then axillary, which stands for armpit. Tympanic is in the ear. The name comes from the tympanic membrane, which is your ear. It's a very accurate and easy way to take temperatures. Temporal is a thermometer that they run across your forehead. So let's talk about what the normals are. Normal oral temperature is 98.6, and the tympanic and the temporal are going to be reported as oral temps, so those normals would be the same. Rectal normal is 99.5. It's going to be higher because you're in a bowel cavity. The lowest normal is going to be axillary because it's skin on skin, 97.6. The term for increased temperature, you may see fever used. You also may see pyrexia used. And if you think of pyro, fire, that makes sense. Mom may have sent you to school even though you said you weren't feeling good because she did the mom test that morning and your temperature went up as you were in school. Temperature is highest at night, so it will be lowest in the morning. If somebody has eaten, chewed gum, or been smoking, then you're going to wait 30 minutes after to take their temperature. The most accurate reading is going to come from a rectal temperature. The least accurate is through axillary. You may be asked to perform temperature conversions. If you have a Fahrenheit temperature and want to change it to Celsius, you subtract 32 from the Fahrenheit temperature and then multiply by 0.5556. I'll give you a chance to write that down. So Fahrenheit to Celsius, you subtract 32 from Fahrenheit and then multiply by 0.5556. If you have a Celsius temperature and you want to change it to Fahrenheit, you multiply the Celsius temperature by 1.8 and then add 32. So Celsius to Fahrenheit, multiply the Celsius temperature by 1.8 and then add 32. For pulse, we're going to be looking at three things, and the first thing we're going to look at is the rate, and that is the speed or frequency of the beats in relation to time. And it is reported beats per minute, BPM. There are numerous factors that can influence the pulse. One is age, another is infection, exercise, fitness level, and with fitness level, the more fit you are, usually the lower your pulse, fever, hemorrhage, and stress. So a lot of factors can relate to that rate. You're also going to note the rhythm of the pulse, and that's the pattern of beats. The pulse should be a steady, constant beat. You can get what's called a bigeminal, where you have beat, 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 and there's a pause. Trigeminal would be 3 beats and a pause. So you want to look at that rhythm. Is it regular? Volume describes the strength or quality of the heartbeat as felt by the radial pulse. So is it easy to feel, or is it really difficult? The normal limits for pulse for adults are 60 to 90. Again, that's beats per minute. Infants, 100 to 140. Some terms for you to learn. Bradycardia, you know that cardi means heart. Brady means slow. So when you say bradycardia, the pulse is less than 60 beats per minute. Tachycardia is more than 100 beats per minute. So tachy means fast. The pulse that's most commonly taken, and the one that you will be learning, is the radial pulse. So here's a brief video on how to assess.
After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers.
Miss Morgan? Hi, my name is Denisha. I'm going to be the nurse taking care of you today, okay? Can I take a look at your armband? Can you tell me your first and your last name?
Jessica Morgan.
Okay, and your birthday?
February 5th, 1989.
Okay.
To take a radial pulse, first assess for factors that can affect rate and rhythm, such as medical history, disease processes, age, exercise, and medication.
All right, what I'm going to have you do is to roll over on your back. And then
Clean gloves are worn only when the nurse may be in contact with bodily fluids or the patient is in protective precautions. Hope the patient into a supine or sitting position.
You want to put your head of your bed down?
If she's supine, place her forearm along her side with her wrist extended, or rest her forearm across her chest or upper abdomen.
Mr. Thompson, I'm going to take your arm and rest it here.
If the patient is sitting, bend his elbow 90 degrees and support his lower arm on the chair or on your arm. Slightly extend or flex the wrist with the palm down. Then place the tips of your first 2 or middle 3 fingers over the groove along the thumb side of the patient's inner wrist. Slightly extend or flex the wrist, palm down, until you feel the strongest pulse. Press against the radius, obliterating the pulse at first, and then relaxing the pressure until the pulse is readily palpable. Now rate the strength of the pulse. Determine whether the thrust of the vessel against your fingertips is bounding, full or strong, barely palpable or diminished, or absent and not palpable. Note the regularity of the rate and rhythm. Once you can feel the pulse consistently, look at your watch. When the second hand reaches a number on the dial, or when the digital display reaches a round number, begin taking the pulse, counting the first beat you feel as 1. For a regular pulse, count the rate for 30 seconds and multiply the total by 2. The pulse rate normally ranges from 60 to 100 beats per minute. For an irregular pulse, count for a full 60 seconds. Note the frequency and pattern of the irregularity. Compare the radial pulses bilaterally and assess for a pulse deficit. For details, review the video skill, Assessing the Apical Radial Pulse. When you're finished, help the patient into a comfortable position.
Are you comfortable? All right. Well, just let me know if you need anything, okay? I'll be right out at desk. All right?
Perform hand hygiene and discuss your findings with her. As part of your follow-up, compare the patient's pulse rate and character with her baseline and with the acceptable range for her age.
Okay, so taking a radial pulse. If you are doing this virtual, then you will probably be doing it on a family member. And I would suggest that you practice quite a bit because it really is something that you need to work on before you're going to be feeling comfortable to check off. Respirations is the process of breathing in and breathing out. Inspiration and then expiration is one respiration. The normal range for adults is 12 to 20, which means that your patient will be breathing every 3 to 5 seconds. Again, you need to note the character and rhythm. If you've ever seen anybody hyperventilate or have an asthma attack, you know that character and rhythm can differ greatly with respirations. Some terms that you need to be aware of. PNEA is going to stand for respirations, and DYS in front of anything always means difficult. So dyspnea is difficult or labored breathing. And A always means absence, so apnea is going to be the absence of breathing. You may see Cheyne-Stokes respirations, and that's going to be periods of difficult or labored breathing followed by not breathing. And oftentimes this is seen before a patient passes away. If I said to you, I'm going to be taking your respirations, you immediately start thinking about a process that is involuntary. You don't have to think and tell yourself to breathe. So once you say that to a patient, then their breathing is going to be altered and you're not going to get a normal respiration rate. So because of that, the patient must be unaware that you are taking respirations. The way that healthcare professionals do that is when they're holding the wrist for pulse, either before or after they count pulse, they'll count respirations. The last vital sign we're going to be talking about is blood pressure. And what we're going to be measuring when we take blood pressure is the pressure that's exerted on the walls of the artery during contraction and then relaxation. So contraction when the heart is beating, relaxation when it refills. So there'll be two numbers. It's measured in millimeters of mercury with the use of a sphygmomanometer. Sphygmomanometer from now on will be known as the blood pressure cuff. A little bit of a tongue twister. Systolic pressure is the pressure when the heart's contracting. Diastolic is pressure when the heart's at rest. So we're going to look at a systolic being when it's contracting, diastolic being when it's resting. So if you have a patient that has an elevated diastolic, that is extremely concerning because we don't want that pressure up when the heart's at rest. It's going to be written as a fraction, so you'll write systolic over diastolic, and systolic is going to be a larger number. The normal range for blood pressure, 100 to 140 for systolic, 60 to 90 for diastolic. When you first start trying to take a blood pressure, you're going to feel like you need some extra hands. It is a task that takes some practice. But I have a video to share with you on obtaining blood pressure. And this is the one-step method.
Perform hand hygiene and ensure privacy. To take a blood pressure by the one-step method, first check the patient's baseline reading and document. Then determine the best site to use. For example, if he's receiving intravenous fluids in his left arm, use the right arm to take his blood pressure. Introduce yourself to the patient. Then identify the patient using two identifiers.
Hi, Mr. Smith. My name's Jillian. I'm going to be taking care of you today. How are you feeling?
I'm okay.
Okay. Can I see your arm bracelet here, and you can tell me your full name and date of birth?
It's William Smith, and my date of birth is June 17th, 1957.
Perfect.
With the patient supine or sitting, position his forearm at heart level and support it with his palm up. If the patient is sitting, have him keep his feet flat on the floor.
Doing okay?
Expose the upper arm fully by removing any clothing that's in the way. Now make sure you have the appropriate size blood pressure cuff for the patient. The cuff's width should be 40% of the circumference of the midpoint of the limb on which it will be used. The cuff's bladder should encircle at least 80% of the upper arm. Now palpate the patient's brachial artery in the antecubital space.
Put your palm on.
Once you locate it, position the cuff 1 inch above the artery, with the cuff's arrows centered over the artery. If the cuff doesn't have arrows, estimate the center of the bladder and place that over the artery. Then wrap the fully deflated cuff evenly and snugly around the upper arm. Clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Next, place the stethoscope earpieces in your ears, following the angle of the ear canal. And make sure the sounds are clear, not muffled. Position the manometer vertically at eye level and stand no more than 1 yard away from it. After relocating the brachial artery, place the stethoscope's bell or diaphragm chest piece over it, but don't let the chest piece touch the cuff or the patient's clothing. Close the valve on the pressure bulb by turning it clockwise until it's tight. Then quickly inflate the cuff, 30 milliliters of mercury or mmHg above the patient's usual systolic pressure. Slowly release the valve on the pressure bulb and let the manometer needle fall 2 to 3 mmHg per second. Note the point on the manometer at which you hear the first clear sound. This is the first Korotkov sound, which reflects the systolic pressure. The sound will slowly increase in intensity. Continue to deflate the cuff gradually, and when the sound disappears, note the pressure to the nearest 2 mmHg. This is the fifth Korotkov sound, which reflects the diastolic pressure. Listen for 10 to 20 mmHg after the last sound, and then let the remaining air escape quickly. For greater accuracy, take the patient's blood pressure again in 2 minutes. Use the second set of measurements as his baseline.
Are you okay lying flat still? I'm going to take your blood pressure on your left side now. Okay, you feeling okay?
Then remove the cuff from the patient's arm. If this is his first assessment, repeat the process on his other arm, if possible. In some facilities, electronic blood pressure devices may be in use. Follow agency guidelines. To complete the procedure, help the patient into a comfortable position. Cover his upper arm again and discuss your findings. Clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Perform hand hygiene. Compare your findings with the classification of blood pressure for adults. Normally, the systolic pressure is less than 120 mmHg, and the diastolic pressure is less than 80 mmHg. In pre-hypertension, the systolic pressure is 120 to 139 mmHg, and/or the diastolic pressure is 80 to 89 mmHg. In stage 1 hypertension, the systolic pressure is 140 to 159 mmHg, and/or the diastolic pressure is 90 to 99 mmHg. In stage 2 hypertension, the systolic pressure is 160 mmHg or higher, and/or the diastolic pressure is 100 mmHg or higher. As part of your follow-up care, teach the patient ways to prevent hypertension, such as exercising every day, losing weight, stopping smoking, reducing sodium and saturated fat intake, and maintaining an adequate intake of dietary potassium and calcium.
Okay, so taking blood pressure, one of the things that we know is that it is difficult when you first start and you need a whole lot of practice. So I've included, and your teacher will have this website, but I've included a website where you actually can take blood pressures digitally. You have either pediatric cases or adult cases. So you go to the adult cases to begin with, and it's going to tell you how to use, and you'll have table of contents over here. So we're just going to pick the first one. You go to that particular one. And we're going to click on here, blood pressure. Once you've heard it, then you can go and enter into the systolic and diastolic. And get my So you're going to enter your number, and if you'll notice, those are always reported as even number. If you hear it in between, you're going to go up. So you put your systolic and your diastolic and submit, and it'll tell you if you were correct or not. So it's a great way to practice. There's some other things you can do at this website, but it's a great way to practice blood pressure. The more you listen, the better you're going to be. Once you feel very confident with pulse, temperature, respiration, blood pressure, you're on your way to having at least one skill down for nursing, assisting, or personal care for competitive events for HOSA. But again, it's vital, and it's one of the ways that we can provide our patients with significant opportunity to have accurate vital signs taken. Thank you for your time.